Hey class, this is Miss Miller. We're going to walk you through your return for the CVAD, flush, IV push, and blood draw.
Okay, we'll go through step by step of the rubric. The first step is to verify the physician orders, and you will have orders on the day of your return, specific orders. Miss Miller's are to draw a PT, PTT, and a CBC. She's also going to push Zofran. So she has, it says accurately calculate the medication dose. So she's going to go you'll pick the medication from several to choose from that day. You'll make sure you've done your drug calculation. Then you'll confirm your safety measures in your book, the duration of the push, the compatibility, and the diluent. Please note in your drug book, if you have Zofran on your orders, it says over 15 minutes. That's for a piggyback. Your book just doesn't say it. If you're pushing Zofran, it's over at least a minute. All right, so the next thing she's done is gather the supplies, prepare and label her flushes and medications. Okay, so she's gonna draw up her Zofran.
Make sure this is Zofran. Check my labels.
So since the Zofran that she's given is just 2 cc's, she's gonna use a 3 cc syringe.
Oh, right, here we go.
And draw up her 2 cc of Zofran because we're using the smallest syringe that will hold the amount that we need so that we can accurately measure it. All right, so guys, you're gonna learn in your CVAD lecture that we use the smallest syringe to measure accurately, but you can't push on a central line with a 3 cc barrel. It has to be at least a 10 cc barrel that you use to flush in a central line. So what she's doing is she's getting rid of 2 cc's of a saline flush. She got rid of that so she's gonna pull it back for the space, and she's gonna put her Zofran in there. So just note, like, Zofran does not have to be diluted, but it is okay. It is compatible with normal saline. So we're just putting our Zofran in our 10 cc syringe. Not only does this allow us to be able to push into the central line, it also allows you to pace yourself. So if you had a push that had to be over 2 minutes or 5 minutes, it's a lot easier to pace yourself with 10 cc's of fluid. So we simply put it in a saline syringe, but then we're going to make sure we label that, the one that has our medicine, so we do not confuse our medicine with a saline flush. So we know that that has our medicine in it. We've labeled it. All right, so she's got her flushes ready, an empty syringe ready for her blood draw. She's got her blood tubes. She's got alcohol to clean with and her gloves. So she's got all her supplies. So the next step is to perform hand hygiene and to put on gloves.
Okay, let me get my alcohol. I'm going to go ahead and open several alcohols because we're going to be using a lot of alcohol to clean the ports. Also, with your tubes, you do need to know which one is for what. My order is for a CBC and an H&H. So I know that the H&H I'm going to draw up first.
PTT.
I'm sorry, PTT. I'm going to draw first, and the CBC I'll draw second. If you're not sure of this when you get in clinical, you can call the lab. You just need to know what resources you can utilize. If you forget, you can call the lab. They'll tell you what color tops to use, which one to draw first. So that's an important resource. Okay, so I'm gonna perform hand hygiene and don my gloves.
The next step is to identify the patient with 2 identifiers.
Okay, I'm gonna look at his armband and I'm gonna ask his name and his date of birth.
And the next step is to verify allergy status.
Do you have any allergies? Are you allergic to anything? So he's not allergic to anything.
Okay. And the next step is to assess vital signs or lab results if needed. Is the medication that you're ordered to push one that will affect hemodynamics or respirations? Does Zofran affect those things? No. So if your order was for digoxin, then for example, you would say, I'm verifying that the apical pulse is at least 60. That's an example of what you need to verify. Or if you're pushing something like morphine, you want to make sure that the patient's respirations are okay. All right. The next step is to remove all the air from our flushes and loosely replace the caps. This is a step that students forget easily in clinical, but these little pre-filled saline syringes, they always have the air that you have to remove.
And I will give you a little hint. I know I told all of my students last semester that had me, if you will pull this back first and then push it up, because it's locked with pressure, and if you keep trying to push it up, it's gonna pop up real fast and shoot out. So if you'll pop it back first and then push it up, you're not gonna squirt your instructor or your patient in the face.
All right.
Okay.
So in this return, you can do all the flushes at one time. That way when you're in the middle of your process, you don't have to stop to get the air out. All right, so if our patient had normal saline going at 50 or TPN going at 60, what do we do before we?
We're going to stop the fluids.
Yes, so you pause any fluids that are going, you pause all of them. The next step is to clean the port. Scrub using a twisting motion for 15 seconds.
So I'm going to be using the proximal access because I'm going to be drawing blood. And we like to try to use this one if it is not occluded or if TPN is not going through there. We typically don't use that for TPN, but we do like to use the proximal for blood draws. You can use the other two, but this is our first go-to. Okay.
So the next step is to flush with 10 cc's of normal saline using the push-pause method. So when we're flushing a line, we use a push-pause method like you've been taught to clear the line of any things that are sticky, just keeping it open, and we use push-pause. And when we begin our process, we're using 10 cc's of saline.
Another thing that students forget in clinical is these need to be clamped when they're not in use. Now this one had normal saline going through it, so it shouldn't be clamped. But if you have resistance, you're first going to check to see if this is clamped.
Is it working?
No.
Sometimes Chester Chest doesn't let us.
So because that one showed resistance, I'm going to clamp it off. And I'm going to try another one. You never push if there's resistance. You don't use that port.
It's not working. Or, oh.
I know. I had some air somehow in there.
So just like what she did, you can disconnect your syringe and reconnect it without cleaning again if you maintained sterility of the port. She held it in one hand, she didn't drop it. It wasn't contaminated. So that's why she didn't have to clean it again to reconnect that syringe, because she maintained control of it the whole time. So after she's flushed with 10, she's going to withdraw 5 and that's for a discard is what we're getting rid of that because we don't want any of our lab work to be skewed by the things that we're infusing or by the saline, anything that's in the line. And so in clinical, you put that in the sharps container.
Yes.
Then we clean the port again, and this time we're going to attach an empty 10 cc syringe, and that's going to be for your lab draw. So it depends on what all you're drawing of how much you need. A lot of times if you're drawing several things, you need the whole 10. But if you know I just need a couple of tubes of 2 cc's each, then you can just draw 4. You draw however much, and the tube says on it how much you need.
So these tubes say one of them needs 2.7 mil and the other one needs 3.0 mil. Because I know that, I can just draw 6 mils out. And maybe a little extra change just in case. Okay.
So as soon as we've done our blood draw, we disconnect it and we attach it to an 18 gauge needle. And that's so that we can put our blood in our vacutainers. You don't want to delay because you don't want the blood to clot or hemolyze. You want to go ahead and get in those vacutainers. Once they're in there, you just gently invert them a couple of times. Again, we're doing the coags first. If you ever had blood cultures ordered, blood cultures are always first.
So these are vacutainers, which means there's negative pressure in there. And this should draw itself out. I'm not pushing in. And these are not going to pull as much because they're used. But in clinical, it should draw out exactly how much is needed. If you try to push extra pressure on it, when you pull out like this, it's going to blow back up.
Yeah.
Okay.
There's an acronym on your rubric, and it's BC-BRGRP, and that's to help you remember the order of tubes. It's just to help you. BC stands for blood cultures. Otherwise, the order of tubes, we remember it by the acronym babies regurgitate green peas, and it means blue, red, green, then purple. So once she's put her blood in her tubes, she's discarding those supplies. The needle, particularly, that goes straight in the sharps, always straight to the sharps. But then the very next most important thing to do is we got to clean that port and flush it with 5 cc's because we don't want the blood in our line to clot either.
And again, I'm doing push-pause because there's no medication in there.
And you can just do 5 when you're working with a central line and you're doing several things. You can just flush with 5 cc's in the middle of your process. We use 10 at the beginning and 10 at the end. But in the middle, you can use 5.
Okay, so I'm labeling these. Labels are either going to already be pre-printed, or if you don't have a pre-printed, you need to have something you could label these with in the room before you walk out.
And we're making sure that if it's pre-printed, that the name on the label matches the patient's armband. And then once we label them, we want to make sure we initial date and time them. You write that on there, whether it was pre-printed or not. You write in the initials, date, and time. We put them in the biohazard bag. That's what we're going to use to transport them to lab when we're done. Right now we're cleaning the port again and getting ready to push our Zofran.
So which one is my Zofran? That's the reason we label, because I have all my supplies laid out, and this one is labeled with Zofran and this one is not.
Okay. So we're cleaning, and then we're going to push our Zofran. And again, we said that Zofran particularly can be pushed over a minute.
Now these are labeled on here, so you don't have to guess which one is medial, proximal, or distal. So this one is my distal, and that's the one I used a while ago. This is to be administered over 1 minute after I looked it up and found out how long to push it over. I will not push pause this one, but I do need to watch my clock and push it over 1 minute.
So we just don't push pause our medication, because since we're just giving medication, we're not needing that to clean the line and make sure it's free of any debris. We're wanting to push it smoothly. We're not wanting to push pause so that we're not bolusing the patient with medicine. Bolus, 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 okay? We're just pushing it smooth.
Okay, after 1 minute, And I finished the whole thing.
Yes, so now we're done with all the things. So we're gonna flush with our 10 cc's because we're done with that line. If you had fluids going, you could flush with 5 and hook your fluids back up. But for an example of if your patient was saline locked, then we'll push with all 10 before we clamp it back off.
Again, because I just pushed medication through there, I'm gonna push this, not push pause. I'm gonna push it slowly over the same amount of time that I push the medication. So if it's 1 minute for Zofran, then I'm gonna flush for 1 minute.
Because remember, there's still medication in your line inside the patient. So if we flush the saline really quickly, then you're still giving the patient a bolus of medicine that's in that central line.
Okay, 1 minute, I completely flushed with 10 cc's.
So when we're done with that, we clamp it back off and we assess our patient for the response of any side effects or adverse reactions. How would we know if the Zofran's effective or not in 15 minutes, Ms. Miller?
I'm gonna go back in and reassess for nausea, any complaints. Also,
Yes.
just reassess general appearance and ask if they're having any complications or any other trouble, especially if this is the first time they've ever had this medication.
Yes. So on your return, consider what medication you were ordered, and on your documentation, when you reassess the patient, your reassessment is addressing what medication you gave. So for the Zofran, we're addressing that our patient is or is not nauseated. If you gave pain medicine, we're addressing their pain again and their vital signs. If you gave something for heart rate, you're addressing how their heart rate and blood pressure is doing. You think about the med you gave, and that's how you assess your patient. So the next step is just that we're going to discard all our used supplies and we're going to perform hand hygiene. And we want you to be able to do this return within 20 minutes. You'll notice on your rubric that everything has points. You have to make a 78 in order to be considered passing. So even, for example, if you go over the 20 minutes, that's just going to dock you up to 4 points. You can still pass. You are going to be required to document, and there will be an example of documentation on Moodle.